know, I think one of the things that's great about eyelid surgery is our understanding really has changed. So when you think of how it used to be done, and it still sometimes is done, you have a situation where it seems to be all about plucking out all the fat around the eyes and taking as much skin as possible. And there's some problems with that. Number one, that tends to create a very hollow eye. And when you think of it, hollow eyes, where do you see those? You know, very old people, people who are starving. So how's that supposed to look young or dynamic? Number two, taking too much skin, it leaves the eye looking very tight and even robs it of its expression. I've kind of shifted my whole approach to eyelid surgery so that we take into account the areas that frame around the eyelid. There's a lot of things that happen in the eyelid really are related to the next door neighbors. If you think of it as we lose fat in our cheek, that tends to unmask the lower eyelid. Same thing often happens in the upper eyelid area. Either the brow comes down, or as we age, we actually lose the fat there, and it gets very hollow and sunken looking. So now what we're doing is really paying very careful attention to the dynamics. Almost every blepharoplasty I do framing with natural fat, and I'm very careful about how much skin you take. Often you need to take very little. Sometimes you can just do a light peel. And of course we take fat when needed, but you don't need to take as much as we used to in the old days. Because when all is said and done, the eyes are one of the most expressive parts of the body, so you don't want to lose that expression. If you do that, that doesn't seem to me a very good outcome.